Okay. Do I have your permission to use this video for educational
Yes,
purpose?
you certainly do.
Okay, thank you. Now, tell me about your life and your pain before the surgery. How was it?
Okay. For years, I have had back pain.
Mm-hmm.
Any amount of walking, any amount of doing anything, it was an intense pain. It was a sharp pain. I
1 to
couldn't-
10. How bad was the pain?
It was a 10.
It was a 10.
I thought if I didn't get off my feet,
Mhm.
I was going to go down.
How far could you walk before the surgery? A block,
Oh.
half a block, 20 yards?
No,
Not
half
even.
a block is
Half-
about it.
okay.
I would, when I would go shopping, I would like to have a cart
Mhm.
so that I could lean on that.
I see.
It was my walker.
Yeah, yeah. You know, and we investigated you, and we noticed you had quite a bad spine. We noticed, you have multiple problems, and I'm going to turn over and show here on the computer that you had problem practically in all the lumbar spine, but most of your problem was actually coming from the bottom two. And there's a way for a surgeon to find out where the problem is mostly coming based on your symptoms. And we decided not to fix everything because some of my colleagues say, if you had as well you had some scoliosis, side bending of the spine, which is corrected. But some of my colleagues say either fix everything or don't fix anything at all. But we decided to fix only the bottom two and not address this one up here, even though it is as well in a bad situation. But you told me that just few days after the surgery, which was a little more than 2 years ago, that you did already notice a difference. What did you notice?
Well, I can walk
How
a
many?
great distance. I
Mhm.
could walk at a great distance. The pain in my back is not preventing me from
Yeah.
walking anymore. I have COPD as well as,
Mhm.
and I get short of breath.
Yeah.
But
yeah.
I do not have the pain even when I'm walking.
Mhm. How long after the surgery did you notice that you can walk longer?
I would say it was almost immediately.
Immediately, yeah.
4 to 5 days.
Yeah.
Yes, I had to slow down a little bit,
But
I was pain free.
yeah. On top of your COPD as well, you have osteoporosis, correct? You have osteoporosis. You have
Yes,
soft bone,
I do have osteoporosis.
and that has been going on as well for years.
I've had that for years, and
Mhm.
yet I've got good bone growth.
Yeah, and I'm here
on,
able to see that the bone is solidly growing both in the front and in the back, and as well that's another thing that especially people who have other problems like COPD and osteoporosis. Many of our colleagues, many of my surgeon colleagues, they are very hesitant to help patient because the results are not very good with the open old-fashioned surgery.
I couldn't believe it. People don't believe that I
Mhm.
recovered from this back surgery so quickly.
Yeah. Now, how long did you stay in the hospital? I believe you went home next day.
One day.
One night after the surgery, you went home.
And
yeah.
I really liked my room, so I didn't want to leave.
Now, may I ask how old you are?
Pardon me?
May I ask how old you are?
I just turned 82.
82. Congratulations. Now, these are all the factors that would be in an open old-fashioned surgery would be tremendously dangerous. Your age, your COPD, your osteoporosis. And even in this situation, our surgery, I remember, it was less than an hour. And you went home next day. Our blood loss was like 1/10 of a soda can. And these are all the factors that really helped you to recover. And even in your situation, we achieved the fusion. And I'm hoping that we will keep all this clinical result, even though we didn't fix everything. We have a saying in Inspired Spine, we say, we fix people, not pictures. Because, if you look at the picture, sometimes you want to fix too much. But our protocols were very helpful to identify what we should fix. And you're approved 2 years later that this really works.
wonderful.
Yeah. Now, do you think you have regained your life where you are where you need to be now?
Oh, I love this.
Okay.
Living with that kind of pain is not fun.
And I understand that. I understand it. Well, thank you so much for the interview. I really appreciate it.
Thank you for all you've done for me, Dr. Abbasi.
Thank you.